Well, the biggest change I think has been the routine asthma visits, which we didn't ever used to do. We'd see people for problems and then sometimes for follow-up, and then sort of assume they'll do better, and if they don't, they'll come back. So the routine has definitely helped. A lot of times we incorporate it, of course, into our well child visits, but often it is a separate visit, which, as I said, we never used to do.
And we as a group have done this as well. The main way we've done this is through empowerment. We give them knowledge, and before that knowledge was inconsistent. Now it's much more focused on certain topics, focused on spirometry, focused on the care with the asthma action plan, focused on follow-up and having our nurse manager with asthma follow up with them too. And the biggest thing is there's no doubt that the tools have become more systematized. So using the spirometry and showing the patient the spirometry results, there's nothing better than showing them the piece of paper or the print up on the computer which shows the curve and explaining how it goes. And every patient, they might not understand anything about spirometry, but they know that 100% is good and 60% is bad. These are things they can really get their hands on and grasp.
She's always touching base with his asthma. So if his asthma's not flaring, she's always wanting to know how's it doing when it's a baseline, you're doing the appropriate tests, or having me fill out questionnaires just to see how he's doing when he's well. So I think that's really important. I think that's been a big step. He has done the breathing tests, and we also, his doctor referred him to an allergy and asthma specialist, and we did the spirometry with him as well. So that's kind of been educational because we can see where his baseline is, and even what is considered the normal may not be his normal, but knowing where his normal is really important. That way we can tell when he's starting to go downhill a little bit, or celebrate when he's really progressing well and his numbers are where they need to be. We were talking about that on the way here. What do you think are some things that you can do now that you couldn't do before?
Ride my bike.
Uh-huh. That's pretty cool, huh?
What else was it?
What did you do?
Play catch.
Uh-huh. And what did you do at Grandma and Grandpa's house?
You played in the snow.
You played in the snow outside a lot, huh? And that's a very big step.
The other time in Kentucky, I couldn't play because of my asthma problems.
Mm-hmm. That's right. So this winter, he was able to play outside in the snow and did not have to use his inhaler, and which is a huge deal for us, because he's always been limited by any extreme cold or hot or heat outside, and having to constantly be on his rescue medication. And now his rescue medication isn't. It's not. Well, it's always a necessity to have on hand, but we haven't had to use it as much, and so that's been awesome. In fact, I contacted his pediatrician because finally, at the age of 7, he made it through his first cold without going into an asthma flare-up, and that is a huge deal, because usually you can just track it right down to the day of, okay, his cold symptoms start, and then his asthma is just out of control. And
I can go place without my inhaler.
That's right. That's right. So it's been a very successful year for us.